Well, we all probably take our eyesight for granted at times, and today we want to talk about properly caring for our eyes and how to deal with vision problems should they come up. Dr. Mansoor Choudhry is an optometrist with Visual Effects Eye Clinic here in Lethbridge. He joins me now. Welcome to the show, Dr. Choudhry. So great to have you on today.
Thanks for having me.
Now, let's start with the basics. How often should we be going for an eye exam?
So in our clinic, we generally recommend everyone to come at least every year or two. For kids 18 or under, we recommend every year. Seniors 65 and over every year for sure. And if you're a diabetic, you're actually covered for an eye exam yearly as well. And that's something that I think a lot of people still aren't really aware of. So just important to get everything checked out if you're a diabetic for sure.
Okay, definitely. Now, you also mentioned kids should go every year. At what age should children start going for their first eye checkup?
As early as 6 months is okay. You can bring them in earlier if you want to, if there's any concerns that the parents have. Like if you notice an eye being turned in or out is are usually common ones, or any concerns at all that might come up, we generally just say, hey, it's better just to bring them in. But we've seen patients as young as 2 months, 1 month, so there's really no age limit there.
Yeah, how do you do an eye exam on such a young little baby?
Well, we hope that they're not too scared, but babies actually aren't as tough, especially if they're sleeping. A lot of people think that the babies need to be awake, but it's almost easier when they're tired because then we can just hold their eyes open and basically get a good look at what's important. Do they have cataracts? Do they have anything going on? But it's usually pretty quick, right? So
Wow. Now, is it just me, or does it seem like more and more kids are needing glasses these days as at an earlier age? Has this increased?
we've noticed some trends of that too. I mean, I think part of it comes from glasses are cool now, so a lot of kids want them. But I think just with everything being close up and in our face, a lot of near work can lead to you being nearsighted. So um, overall, though, over the last several years, it's been pretty consistent. But I've heard that too. That we seem to notice more kids requiring glasses or becoming more nearsighted. And I think
Yeah,
it's just from
I was wondering if it's
staring at
from
things close
more,
up could
yeah,
have a
more.
factor.
I was wondering if it was from more and more screen time. We have screens in our face constantly now, so that might be having an adverse effect on our eyes. What's your opinion on that?
It definitely can be, not just from the standpoint of needing glasses, but when you're staring at something up close, you tend to blink less. We're finding blue light isn't that great for our eyes either, and just for kids' sleep cycles too, right? So if they're doing it at night or at odd times throughout the day, it can kind of throw them off their routines.
That's a very good point. Now, other than that, do we know what else might cause eyesight to decrease? I assume age is a factor, but is there anything young people can do to prevent their eyesight from becoming impaired?
Well, overall, the best advice I give all my patients is just trying to be as healthy as we can overall. Um, the more you take care of your body, your eyes tend to follow suit because, well, they're connected too. But an interesting fact for children or kids is getting enough sun exposure. There's been some research into kids that didn't have as much sun exposure were more likely to become nearsighted, and that's another great way to kind of gently nudge them off their iPads and the close up stuff. Right? Is so playing outside is more important than we think. Right?
Yeah, exactly. Put down the iPad and go play outside. Go pick up a basketball. It's good for your eyes. That's a good argument that parents can have now. So, when we start to have trouble reading the small print, should we be getting bifocals? I know some of us just go get those reading glasses from the drugstore, myself included. Are those okay, or should we be actually getting bifocals?
Well, it really just depends on what's going to work best for you. So, with over the counter reading glasses, for example, they can work really well for some patients if you don't mind taking them on and off all the time. Because once you have them on, you might be able to see up close, but anything past about an arm's length is going to be pretty blurry. Also, a lot of people, their prescription's different in each eye. So, figuring out what prescription might work best for you would it'd probably be a good idea to get your eyes checked first, and we could recommend if you need just reading glasses, or if a multifocal lens might be an option for you too. It just depends on what's going to work best for your lifestyle, right? So several
Okay.
factors go into that too,
Yeah.
but
Now, do you have any advice for those who wear contact lenses? Sometimes I know infections can happen or we get really dry eyes.
yeah, the biggest piece of advice I just laugh because I know all our colleagues kind of, we have our issues with it, but just following the manufacturer guidelines. So if you have a contact lens that's you're only supposed to wear for 2 weeks, don't wear it for 2 or 3 months. Don't sleep in your contacts if you're not supposed to. Try to give your eyes a break too. Generally have at least 1 or 2 days per week where you're just in your glasses. And I usually tell my patients not to wear their contacts for any more than 10 to 12 hours a day, just because it is so dry here. And it just helps keep the eyes healthy and reduce the wear and tear.
Yeah, that's great advice. Now, I understand that there is a relatively new development for contact lenses that can actually help stop the progression of nearsightedness in children. Can you talk about that a little bit?
Yeah, we've had these contacts for a lot. They've been available for a few years now, but basically to explain how they work is when you're nearsighted, generally your eye is a little bit longer than average. So the light's not hitting the back where you want it to, it falls short. So the idea behind these contact lenses is that it forces the light to fall just a little, almost right at the back of the eye, but it splits it up a bit to go a little bit further ahead. And what this does, long story short, is it helps prevent the growth of the eyeball itself overall, and it can slow down the progression quite a bit.
Wow, that is fascinating. What modern science can do,
Yeah, it's pretty cool.
it really is. So now, what about multifocal contact lenses? How effective are they compared to glasses with bifocals?
They can be pretty comparable. Again, it just depends on your prescription. If you have a really complicated prescription, it might be a little bit harder to get you fit into multifocal contacts. But that's just something that, sometimes it's trial and error. We try a lens on a patient, see if it works, have them come back in a few weeks, and we just make some tweaks and move on. And hopefully, after a couple of visits, we find a lens that's comfortable for them. But I would say it's pretty successful for most patients nowadays.
Yeah, that's awesome. Now, in addition to this, of course, there are some very serious eye issues. So, cataracts being one of them. What is the cause of that, and at what age do they tend to start? I know you'd mentioned that in infancy, then even you're looking for cataracts. I had no idea an infant can have a cataract. So, what's the cause of that?
So with cataracts, generally the number one reason people have cataracts is just due to aging. Everyone's going to get them eventually. It's nothing to be worried about. It doesn't hurt your eye or harm your eye. It just causes us to see blurry. Some patients might develop them younger. For instance, if there's children or infants, it could just be congenital, right? It's something you're born with. If you had an injury to the eye, sometimes that can induce an earlier cataract. Depending on what medications you're taking, that can sometimes induce cataracts as well. Basically, it's the lens in your eye. It's kind of like the windshield. When the proteins change over time, it just becomes less transparent. And that's when patients start to complain that things are getting a little foggy or their vision's just not as clear as it used to be. They also feel like their glasses are dirty or their vision's just kind of smudgy. And then they come in and, there's a cataract just sitting there. So
Wow. Now, that can obviously be removed with surgery, and a lot of people are going for cataract surgery. So, how much of a process is this, and how successful is it?
it's a fairly simple process. If you get your eyes checked, we notice a cataract, we just refer you to one of our great ophthalmologists in town, or if you want to go to Calgary Medicine Hat, wherever you need to be. And it's a pretty simple process. It's very effective. It's very safe. Cataract surgery has been around for a very long time, and the prognosis is usually very, very good. Patients are usually very happy, and it's not very painful. It's pretty easy to take care of yourself after, as long as you can use some eye drops. But it's a pretty easy process overall.
That's good to know. Now, what about glaucoma? This is another one that we hear about. So, can you explain what this is and what the cause is?
So with glaucoma, we're not too sure exactly what causes it. It's basically a progressive degeneration of your optic nerve. And the biggest risk factor we find that most people can relate to is high eye pressures. Once upon a time, high eye pressures meant you had glaucoma, whereas now, of course, we understand there's several factors that can cue us into diagnosing that or not. But the simplest explanation is just your optic nerve that progressively degenerates over time. And the cause, sometimes it can be induced. If you had an injury that increases your pressure, or other physical factors of your anatomy that might make you more prone to it. But overall, it can be linked to family history as well.
So, what kinds of treatments then are available for glaucoma?
Most of the treatments are geared towards lowering the intraocular eye pressure. So commonly first line is either eye drops, of different prescription eye drops we can use. And what's becoming more popular also in first line treatment is minor surgeries that can help alleviate the pressure too. So some of our patients that just don't like using eye drops or can't get behind that idea or won't be compliant with that, we sometimes think minor surgery might be a better option for them.
Okay. Now, you hear a lot of people who are bothered by floaters in the eyes. So, what is this? What causes it? Can it be serious?
So floaters can be serious if they're something new, if you're noticing more of them, or you're noticing flashes of light or anything odd in your vision. We generally ask patients to come in the same day. Even if you're unsure, it's better just to be on the safe side and get into a local optometrist to have them take a look at the back of the eye. What floaters are is the very back of our eye, there's a kind of a jelly like substance called the vitreous, and pieces of that can break off or clump together and basically cast shadows in the back of the eye, which is what you see. So when you move your eyes left to right, it's kind of like shaking a snow globe, except instead of having multiple snowflakes, it's just one or two or little chunks. So, but generally they're not very harmful. But again, if they're new and you're noticing more of them or anything different, it's best just to have your eyes checked.
Yeah, that actually sounds way more serious now that you explained what it actually is. I've never had it explained like that. I had no idea. So thank you for the education there. Now, more and more people these days are going for laser eye surgery. So how successful is this? How long does it last? Are you basically cured forever? Do you have to go back again in the future?
That's a great question. I've actually had laser eye surgery myself. I used to be really nearsighted. Um, and the different types you can get, if you there's certain ones that they'll actually warranty for a few years, but there's certain procedures that'll warranty forever too. So if it starts to change or if your prescription starts to regress, then they can do a minor touch up. But again, everyone's different, right? It's individual. Some people have had it for decades and haven't noticed a change. Some people had it for a few years and they noticed that it was starting to regress as well. But for the most part, if you have a really high prescription and you get laser surgery done, it probably won't ever go back to as bad as it originally was. Like you might need glasses again to see far away, but and they're always improving it too, right? So it's very
Yeah.
individual, but for the most part, it's quite successful.
Okay, so we sometimes hear about these poor outcomes with laser eye surgery. So do you have any cautions for people considering having the surgery done?
Just follow your surgeon's guidelines. They're going to give you a schedule of drops and changes in your routine to undergo, and just follow them strictly. So, I mean, they're your eyes. You just paid a bunch of money to get this surgery done. So, I think it'd be kind of silly to not just listen to the experts into what's going to give you the best results. And if you notice anything that's concerning again, whether it's after day 1 to week 1 or 2, just either contact them or contact your local optometrist so they can make sure it's nothing too serious.
Great, great advice. Thanks so much for being with us today, Dr. Choudhry. So glad to have you on today.
Yeah, no problem. Thanks for having me.